Welcome back, friends. We are going to do another live anatomy tutorial where I'm going to build a whole nother vertebra for you. We're going to go down to C2. We did C1 last week, and so I'm going to just add on to that model and see how these things fit together. So let me switch over to my screen here, and this is the C1 model we built last week. If you want to watch that video, it's linked above here. And I've drawn the dens, or the odontoid process of C2, as just a cylinder here to show you that this serves as the pivot point for C1. So C1, which allows the majority of our head rotation, will pivot around our axis here, or our dens for C2. And so let's build onto this. So the dens is usually going to be a bit rounded like this as it articulates with the anterior arch of C1. And then it's going to come down here into our vertebral body of C2. And so let's just mask off the dens here and add on these shelves which C1 has to sit on, which extend out from the C2 vertebral body. Let's just add some vertebral body here. And the vertebral body tends to bulge out just a little bit here like this, and the posterior surface extends down from the odontoid process, and then we have our inferior end plate of C2. So let me just push this up here a little bit. And so this tends to be a bit concave, as you can see here. And let me just broaden this out a little bit like that. All right, so that's looking pretty good. So that is our C2 vertebral body. And let's just build out these shelves a little bit here so that they can support the entirety of the undersurface of the lateral mass of C1. Okay, and so it will more or less match that contour, and that is our lateral mass of C2. And so these are essentially going to be equivalent to the superior articular facets of our lower cervical vertebra. But now we have to bridge down to our articular pillars in the lower cervical spine. And so we need to build a structure to do that. And so this is essentially equivalent to the pedicle of the lower cervical vertebra, but it's serving as a pars interarticularis region, similar to what we have in the lumbar spine. And so let's just drag this down here and add in some inferior articular processes, which are going to be oriented somewhat like the axial plane in the lower cervical spine, you know, a bit off of that, but they're actually going to be just slightly tilted towards the sagittal plane. And so let me build that in here. And then let's just bulk these out a little bit. They have a little bit more mass than that. And now what we need to do is we need to now connect this to the rest of our posterior elements. So we need to build some lamina here and bring these back to the midline. And this is going to serve as the posterior surface of our neural arch. And then we have to connect this back here with the C2 spinous process, which is our biggest spinous process in the cervical spine, like this. And now we've got a spina bifida occulta. So let me bulk this out a little bit so we can connect these two up together. And now I'm just going to come down here in the menu that you can't see, and I'm just going to remesh this so that we can kind of merge this structure together. All right, and now let me smooth this. So now we've got this all connected up here, and I intentionally left these separate because this is our bifid portion of the spinous process, which is a normal feature in the cervical spine. And so the C2 spinous process tends to be a bit triangular like this. So let me just fix this geometry here a little bit, and that is looking pretty good. So we are essentially done with our C2. The last thing we need to add here is our transverse processes, which are going to extend off of this lateral shelf, and they're going to be oriented pretty steeply downwards here, such that we can typically see the transverse foramina on a lateral cervical radiograph. And let me just fix this shelf here a little bit. All right, and let me just pull this out. All right, and so now let me go ahead and add a little foramen through here, because these are going to have a transverse foramen just like every level in the cervical spine does, to provide a path for our vertebral artery to pass up. So let me go ahead and add that right now. All right, so I've built these holes through these transverse processes here, and so you can see how that looks. And so we just have a little bit more work to do on this model here. Let me just turn my symmetry back on. We've got to clean this up a little bit, but this is essentially the appearance of C2. And of course we could adjust this canal. It is a little bit too big here, so let's just go ahead and bring this in a little bit and make it match the contour a bit better of the C1 posterior arch here. All right, that is looking pretty darn good. And so last here, I wanted to show you my finalized model of C2 after I put a bit more time into it, and just a few of the things that we didn't quite get right on that, quick draft model. So these transverse processes you can see extend off here. They're a bit more pointy, and the posterior rim of that actually extends back to join to the pars/pedicle region just above that facet here. And the other thing that I forgot, honestly, to add was the little facet here for the uncovertebral joint as the untitled process comes up to C2 to articulate with it there. So this is my finalized model for the high quality render, and maybe I'll just toss in a little turntable here so you can kind of look at the full render version of that. So one other thing I wanted to do was I wanted to show you how this kind of correlates to a CT scan here. So let me scroll out all the way laterally here, and so let's come into C2. So we first see the facet joint back here, and you can see that just like that diagram I showed you, the posterior rim of the transverse process comes back here. Here's our transverse foramen. And then this comes up to that lateral shelf, which articulates with the lateral mass of C1. And then this is our pars/pedicle region. Coming back, bridging between the lateral facet with the lateral mass with the inferior articular process of C2. And then we come in here to the vertebral body and notice how the posterior surface of the vertebral body lines up really nicely with the dens. There's a little bit of retroversion of the dens here, which is normal. We have a little bit of a physeal scar here. And then notice how the anterior surface is a little bit more bulged out here. And then we scroll through to the same anatomy on the other side. All right, and so let me show you something that I think is important to note here. So let's come over to these facets, and let me just see if I can draw on here and look at the orientation of this facet compared to these ones. So the lower cervical spine facets are just off of the axial plane at about 40 degrees or so, but the C2-3 facets are actually sloped up a bit here, such that we don't see through that on our lateral x-rays. So just something I think that's worth noting, because I think occasionally I see people over suspect that there might be fusion there. All right, and then we come back here to the spinous process, and again, notice that all the cervical spinous processes are bifid, and the C2 spinous is quite large and has these large bifid processes typically. So I just wanted to correlate that anatomy a little bit for you. And again, here, look at the slope of the transverse processes as they come off of the lateral mass of C2 here, more vertically oriented in the lower cervical spine, which are much more horizontally oriented. So if you like this video, you like watching me build anatomy live and talk about it, go ahead and hit that subscribe button, hit the bell notification so you see my future videos, hit that up like, that really helps draw traffic to our channel, and leave me a comment that will also make the video a bit more popular and help me out. It will give me some useful feedback if you say something valuable. So I look forward to seeing you again soon, and I will see you next time.